The topic for today's discussion is upper GI endoscopy. The first question which comes to our mind is, what is upper GI endoscopy? Upper GI endoscopy is a procedure that enables the examiner, usually a gastroenterologist, to examine the esophagus, swallowing tube, stomach and duodenum, which is the first portion of the small bowel, using a thin, flexible tube which has light and camera attached to the tip, which shows the lining of the esophagus, stomach and duodenum, and can be viewed using a TV monitor. The next question which comes, how do I prepare for endoscopy? To accomplish a safe and complete examination, the stomach should be empty. The patient will have to most likely to have eaten nothing to drink for at least 6 hours or more prior to the procedure. If the procedure is planned in the morning, then the patient needs to be empty stomach throughout the night. Or if the patient is planned in the afternoon, then he requires at least 4 to 6 hours of empty stomach. Prior to scheduling the procedure, the patient should inform his or her physician of any medications they are currently taking, any allergies, or all of the health problems. This information will remind the doctor whether the patient may need antibiotics prior to the procedure, what are the potential complications which should not be used during the examination because of the patient allergies, and also it will provide the individual scheduling of the procedure at an opportunity to instruct the patient whether any of these medications they are taking should be held or adjusted prior to endoscopy. Knowledge of whether the patient has any medical health problems such as heart disease, lung disease, diabetes, hypertension will alert the examiner of the possible need for special attention during the procedure. This is very important at the time if the patient is suffering from diabetes. The patient has to be empty stomach, so should avoid the morning diabetic medication. At the same time, if the patient is suffering from hypertension, he or she should take the hypertensive medicines at least 3 hours before the procedure, so as patient is okay during the procedure. Now the important question is, why have you been scheduled for an endoscopy? What are the various indications for the endoscopy? The upper GI endoscopy usually is performed to evaluate the possible problems with esophagus or the food pipe, stomach or duodenum, and to evaluate the symptoms such as upper abdominal pain, nausea, vomiting or blood in vomiting, difficulty in swallowing, intestinal bleeding including anemia. Upper GI endoscopy is more accurate than X-ray for detecting inflammation or smaller abnormalities such as ulcer or tumor within the reach of the instrument. It is other major advantage over X-ray is the ability to perform biopsies, obtain small pieces of tissue or cytology, or which is obtaining some cells with a fine brush for microscopic examination to determine the nature of abnormality and whether the abnormality is benign or malignant or cancerous. Biopsies that are taken for many reasons and may not always mean that a cancer is suspected. This is very important. And the upper GI endoscopy can also be used to treat many conditions within its reach. The endoscopic channels permit passage of accessory instruments, enabling the examiner to treat many conditions such as stretching areas of narrowing strictures, removal of benign growth such as polyps, accidentally swallowed objects, batteries, or treating upper GI bleeding as seen in ulcer tears of the lining. These capabilities have markedly required the need for transfusions or surgery.